Hi, and welcome to another episode of Young at Heart. I'm Tammy Murray, your host, and today joining me is Anna Kelly, the Shine Counselor at the Kingston Council on Aging, as well as the Hanson Council on Aging. Hi, Anna. How are you today?
Very well, thank you.
Thank you for coming.
My pleasure.
I feel that this is a really important topic to discuss. It's all about Medicare, how to apply for it, how to apply for Mass Health. And Anna is a volunteer through the SHINE program. So if you wouldn't mind just explaining a little bit what the SHINE program is.
Sure, I'll be happy to. The SHINE program is a state-sponsored program that provides counseling for recipients of Medicare or those who may wonder if they're eligible for either Medicare or Mass Health. SHINE stands for Serving the Health Information Needs of Everyone. Formerly it said elders, but we decided that it needed to say everyone because individuals with disabilities and other non-elder recipients of programs are eligible for some of these programs. So that's what the SHINE program is. I'm a volunteer, and I do my counseling at two senior centers, the Kingston Senior Center and the Hanson Senior Center.
And what do you have to do to become a SHINE counselor?
There's a training program that's provided by the regional director, usually a group of individuals who are interested in providing counseling, take classes for a summer, and after they complete their coursework, they take an exam, and they must pass the exam to be certified, and then every year thereafter, they take a certification exam.
So that's actually a lot of training for a volunteer program,
Yes, it is.
which we appreciate because you do a great job at SHINE Counseling. Could you tell us a little bit about your background and what brought you into this?
Sure, I'd be happy to. I'm retired, and when I retired, I knew that I wanted to do something like SHINE Counseling. My background, after college, I worked in laboratories, and I was, my last position in laboratories was an administrator for pathology and clinical pathology. And then I went back to grad school to learn more about healthcare policy. So I worked for 12 years as a healthcare policy analyst for a federal agency, and then I retired and decided to become a SHINE counselor.
Which is great because with all that experience, you bring a lot to the table.
Thank you.
Yes. So to start, I guess we could start simply with what is Medicare?
Sure.
With that.
Medicare is the federally funded program for individuals over 65 or individuals with disabilities and individuals with certain chronic debilitative diseases like Lou Gehrig's disease, end-stage renal disease, etc. So there are a lot of people who qualify, not just by virtue of being 65, but also because of certain conditions.
So you will or are able to see someone who might be in their 30s who has a
Absolutely.
disability or something like that.
Absolutely.
So I just want to make that clear so
Yeah.
people know that they can call the center and get an appointment with you.
Absolutely. Any questions, just come on in.
Okay, and then there's different types of Medicare. Is that
That's
correct?
true. And today we'll talk about the different types of Medicare. All individuals who become 65 and have enough work credits, which is 40 work credits, which basically means you've worked full-time for 10 years, are eligible to apply for Medicare Part A. You can also apply through your spouse's work history. So stay-at-home moms who never worked or stay-at-home dads who never worked can apply for Medicare.
Okay.
And so it's a federally sponsored program that provides health care services. There's Part A, B, D, and there's other types of Medicare which we're going to get into. Basically, through these programs, it allows people to obtain health care coverage. Some of the portions of Medicare require premiums. There's usually a deductible and a copay. So those are three terms that I'll be talking about today.
Okay. And I guess we could just jump into where you think the best place is to start.
Okay, so eligibility, U.S. citizen, work history, specific diseases that I mentioned. And then generally what happens is the eligibility begins at the Social Security office. When you apply for Social Security, you are going to be asked by an intake coordinator, do you want to apply for Part A? They will also ask you if you want to apply for Part B, and they'll verify your work history to get you signed up. So we can talk about Part A to begin with. Part A is a non-premium based. In other words, there's no premium for most people who have enough work credits. If you don't have enough work credit, or your spouse doesn't have enough work credit, then you can pay for Part A. However, the premium can be pretty steep. It can be up to $407 a month. Many people who reach the age of 65 and are short of credit just continue working, and that's fine. What does it cover? It covers hospital inpatient care. It covers nursing home or skilled nursing facility. It covers home health care services and hospice services for terminally ill. Those are the highlights. There are other things it covers, but those are the highlights.
Okay.
As far as the cost, I mentioned that there is no premium for most people. If you go into a hospital, there is a deductible. I'm going to give you the rates for 2015.
Okay.
The deductible for hospital stay is $1,260. And I have to say that when you go into the hospital, you need to be admitted as an inpatient. If you're under observation, that's not the same as being an inpatient. So it's important to know, are you an inpatient or are you an outpatient? So that's the first thing. If you're an inpatient, there's a $1,260 deductible. After that, Medicare pays for pretty much everything, but there's a 20% copay. If you go into a skilled nursing facility, the first 20 days are free, not free, but covered. After that, you pay a small amount. Home health care is zero if it's medically necessary, and hospice is zero copay if it's terminally ill. And that really is based on the physician's determination.
Okay. So if I could just stop you there for 1 second. If you go into a skilled nursing facility, you only stay there the 20 days and then you get nursing in your own home,
Yes.
then that's pretty much all covered.
That's correct.
Okay. Okay. So
That's
it's when you
correct.
exceed those that you would end up paying the additional.
The scenario you just outlined, you need to be qualified as an inpatient for 3 days
At the hospital?
at the hospital,
Okay.
not observation status. Then you go to rehab facility. It's totally paid for the first 20 days. Then you go home. Home health care is paid for. Zero copay.
Got it. Okay. Thank you.
Shall we go on to Part B?
We shall.
Okay. Part B is a different animal. And when I talk about A and B, this is part of traditional Medicare. In 1965, when Medicare was established, it was established to help people with hospital bills. Over time, medical visits were included, which is what B covers. And this is something that people have trouble with because when you come out of the work environment and you're used to having a one plan that covers everything, you're going, why do I have A and B and Z and D? So it's important to know that A is hospital, B is outpatient. So basically, it covers your doctor visits, it covers your diagnostic tests. Not 100%, there's a deductible and a copay, and it covers your ambulance. It does not cover, and this is important for seniors, vision, dental, and hearing exams, unless there's a comorbidity that requires it. For example, if you have a condition like diabetic retinopathy, then yes, then vision is covered. So for most people who are healthy, vision, dental, hearing, not covered.
Okay.
Now we'll go on to the Advantage plans, which I call Part C, and it's often referred to as Part C. And here's where we get a bump in the road, because people need to know that Part C is basically, think of it as the combo plan. Like if you went to a fast food restaurant, A and B are traditional Medicare. C is another animal. It's a combo plan. It combines A and B. Sometimes it also includes other things like vision, dental, and drugs. A and B do not cover drugs.
Okay.
Okay, so Part C is called Medicare Advantage, and I think I didn't mention that Part B cost $104.90. That is a premium based. And it also has a deductible and a copay. So Part C ranges from 0 premium all the way up to $150. And all of the rules that applied under traditional Medicare do not apply under the combo. So each plan can define the benefits differently.
So why wouldn't you just get Part C?
You can. Some people choose to get Part C. And however, sometimes Part C can have a large out-of-pocket cost.
Okay.
Even though there's 0 premium for some of the plans, you have to be careful when you are entertained during open enrollment period in every fall. You have to be careful to ask, what is the maximum amount that it would cost me out of pocket? Some of the 0 premium plans have a $6,700 out of pocket cap. However, most of the Advantage plans have a $3,400 out-of-pocket cap. That matters. So
when you say a cap, is that like a deductible? So once you pay up to that amount, or I could pay $20 for all my visits until I hit that $3,000?
the second part of what you're saying.
Okay.
The out-of-pocket cap has to do with whatever you paid for your deductible and whatever you paid for your copay. So if you went into the hospital and you paid the $1,260 and then you paid your 20%, your bills could keep going until you got to $6,700.
Got it.
So, so I talked about the premiums. I talked about what it covers for C. Now let's talk about D, because it is something that was very debatable. I think it was during the Bush Al Gore debate that the issue of why isn't drug coverage offered to Medicare recipients, and it became a political and a policy question. Finally, and I won't tell you who said what, but different policy positions were established, the end result being that D was offered as a federal program. The range for this, for the D coverage, for the drug coverage, is anywhere from $15.70 up to over $100. So there are about, in Massachusetts, there are about 27 companies or plans that are available that individuals with Medicare A or B can choose.
For Part D?
For Part D, for their drug coverage.
So is that when somebody buys like the prescription plan? Is that what that is? Okay.
Yes.
Okay.
Yes. So if you didn't go with an Advantage plan with the drug coverage and you wanted to go traditional Medicare, you would have A, which premium free, B, $104.90 premium, and D, the cheapest premium is $15.70. And then you're covered for hospital, outpatient, and drugs.
Okay. All right.
Okay, so that's the D plans. There's one other plan that is available under traditional Medicare, not under Advantage, although that has changed this year, but I don't want to go down that road. Traditionally, A and B and D would be the plans that you have, and you can get a supplement. If you didn't want to pay that deductible, if you didn't want to pay those co-pays, there are a number of plans that are available that offer you supplemental coverage. So the premiums for those range from $95 to over $200, so up to $250. The lower cost ones will just cover your copay. The higher price ones will cover your copay and deductible for A and B, not D.
Okay. I'm making sure I'm getting all, this is a lot of information.
This is when people come to my office
Yep.
and they're new to Medicare, this is what they get.
Yep.
This is like the alphabet soup of Medicare.
And it's so important to come to someone like you. I know specifically when my mom was retiring and we were going through all this information, and I had a friend who used to be in health insurance, we tried to figure out what was best for her, and then later we had her come and see you, and it turned out that you could get her the deal much cheaper than she had had before. So I think it's really important that everybody know to see someone who has been trained, just to save yourself, if you can, some money here and there. I don't know if I'm jumping ahead, but income and assets, where does that fall in the traditional Medicare setup?
That's fine. In traditional Medicare, income does matter, but if you make under $85,000 in your retirement mode, then what the numbers I gave you are accurate. If you make over that amount in your retirement monthly income, you may be charged a little bit more. So for the B, which is the $104.90.
Now, did you just say 85,000? Okay, I just wanted to make sure. Okay.
There are people who make more.
I know, no, obviously, I know that there are, but I was just making sure I understood. So these prices and these premiums are for anyone up to that 85,000 a year point, and then.
Correct.
Okay.
Correct.
Got it. Okay.
Most of the people I see make a lot less than 85,000.
Right.
And they want to get the best bargain for their money. And insurance is all about risk. It's all about what are the things that I think I'm going to need. And that's why when they come to see a Shine counselor, I ask them to bring their Medicare card, which has their Medicare number, the effective date for A and B, if they have it yet. And I ask them to bring a list of the medications, because when I plug that information into the computer, I have the most up-to-date information. For example, right now I have it up to date as of May of 2015. So I have the most up-to-date information, and I can do a search, and I can get the best plan for that person based on their medications.
Okay. And then the asset piece, do we want to get into that yet?
Assets are not a factor for Medicare.
Okay.
They do become a factor for the discussion about Medicaid. What's the difference between
you read my
Medicaid
mind.
and Medicare?
Yeah.
Okay, so I mentioned that Medicare is a federally funded program. Medicaid, and here in Massachusetts we call it Mass Health, is a combination of federal and state dollars that are funding it. So, but the state gets to make the rules. State makes the rules, sets the thresholds. It's generally geared toward the poverty line, which is 100% of the poverty line is around $1,000 a month.
Okay.
Which is around $12,000 a year for individuals. So if you're an individual who makes about $12,000 a year, you are eligible for Medicaid.
Okay. This could be an out-of-the-box kind of question, but in a skilled nursing facility, if you're there your 20 days, then you switch and apply for Mass Health, or is
Actually, if you're there for 20 days, it depends on what your condition is, your diagnosis.
say I have to stay there indefinitely?
Forever?
Yeah.
And you're thinking long-term care? Okay, so that's at the very end.
Okay, all right, we can wait.
We can cover that now.
Okay.
Very, very briefly.
Okay.
If you are 20 days, even if you're 10 days in the nursing home and it becomes apparent that you need to stay there, then you need to know what the income and asset levels thresholds are in order to apply for Mass Health or Medic, which I'm going to use the phrase Mass Health
Okay.
from now on because
Yep.
that's what Medicaid is here in Massachusetts. So the income and asset thresholds I'll get to towards the
Okay.
end.
Okay, great.
Okay, so for Mass Health, there are many different programs that help you with different aspects. Some will help you with your Part B premium, that $104.90. If you can't afford to pay that, there's a program that can help you with it if you qualify.
Okay.
Those drug premiums and drug copays, if you can't afford it, there's a program that can help you. There's actually a federal program and a state program, which I can cover.
Okay.
So we got B covered, we got D covered, we got the whole shebang covered, and then there are other situations like long-term care.
Okay. So is it safe to say that many of the people who are struggling to pay for their prescriptions just don't know about these programs?
I would guess that is the
Okay.
case.
Okay.
Because there are some great programs
Okay.
to help with the drugs.
So if anybody has any question whether or not they would qualify, they should get in touch with us to get an appointment with you to find out for sure. Okay.
That's
Yep.
absolutely. So Mass Health Standard, which our Medicaid is, the asset level is $3,000 for a couple, $2,000 for an individual. The income level is $1,000 for an individual, $1,348 for a couple. It's pretty low. But there are people out there who are actually even below that. And if you are below that, you can also apply for another program which is called Social Security, SSI, Supplemental Social Security Supplemental Income. It's not the same as SSDI, which is
Okay.
disability. So I just want people to know if you're a single individual and you make less than $1,000 a month in income, you can apply to the Social Security Department for supplemental income.
Okay.
Okay, so we'll start with drugs because that's where we have the most availability of help. The first I'm going to talk about is called Low Income Subsidy, which is a federal program. It's also known as Extra Help. You can apply and you might get full extra help depending on your income, which pays for your premium and copay, which is nice. You don't have to pay, you know, if you've got that $1,570 premium, you don't have to pay that per month, and you don't have to pay the copays.
Okay.
Partial reduces the premiums, reduces the copay. It's a great program. The Prescription Advantage is a state program. The state program has no premium up to the maximum income, which is in the $75,000 range
Okay.
per couple. When you get to that point, you have to pay a $200 annual fee. So if you need help with your medications, Medicare can provide either full extra help, and this is for people who are at 135% of the federal poverty level. Now I mentioned 100% is around $1,000 a month. 135 is $1,350 a month. There's another program that allows people to have up to 150% of the federal poverty line, which is around $1,500 a month. So that's how you would know. Income level is $1,344 for individual, $1,812 for couple, and the asset level is $8,780 for individual, $1,390 for couple. For the LIS, which is what we call the Extra Help, the federal program, there's no deductible, and your co-pays are only either $265 all the way up to $660.
Okay.
$660 is very good. When you think about some of the cancer drugs that people have, it could be $900 for one of those drugs. If you are low income, this is really going to help.
Okay. I hate to say this, but we only have a couple minutes left.
Okay.
So
Well,
what
we've
are some of the
covered
key
most
points?
of
We
it.
have covered most of it. And
Okay.
I think some people will have to watch this twice. I know I will. But what other...
I'll just cover one more,
Yeah, that
which
would
is
be great.
Prescription Advantage,
Yep.
the state. One thing I want everybody to know is for the state program, there is no asset test. No asset test. You can make up to $6,638 per couple. And it helps in the lower income, it helps you by capping your copay. And in the higher income, it helps you when you get into catastrophic cost. There are also buy-in programs which assist with your premiums and your copays. And then there's something I want everybody to know about called Health Safety Net, which helps you to pay for all of your costs at a community health provider, which is, we have one here at Cordage Park.
Okay.
And also it covers your inpatient cost.
Okay.
So I think those are like the top points that I wanted to get across today.
Yeah, it's a lot of information.
It is.
And I think we did cover a lot of what people would like to know. And for more information, they can reach out in Kingston, obviously, in Hanson, they can reach out to their Council on Aging and get an appointment with you. But for anyone else who might see this show, you can call your Council on Aging, and most of them do have a Shine
That's what I
counselor
want
in the
everybody to
area.
know. Most senior centers have a Shine person. So if you're in Plymouth, you can go there. If you're in Duxbury, you can go there. If you're in Hanson or Kingston, you'll be seeing me.
Okay, great. Thank you so much for
You're
coming.
very welcome.
Maybe we'll have you back again sometime
Okay.
to cover what we didn't.
Okay,
And thanks
sure.
everyone for watching. Take care.